which Bernadette and Penny have set up for us. Women's History Month, we're looking at past, the present, and the future of our local women in medicine. Linda Jack, who is the director of the board on the Historical Society and a local historian. Her research illuminates underreported stories. Our local Sisters of Mercy and their role in assisting Nevada County's most needy populations for over 150 years is a story that she is going to share with us with some just astonishing photos. Dr. Dawn Harris, a distinguished graduate of Chicago Medical School, Rosalind Franklin University, who completed her residency, local angle here, at UC Davis Med Center. She's been with Sierra Nevada Memorial Hospital for 17 years. She is currently the medical director for emergency services and the chief of medicine. So you can't get much more than women in medicine than that. And I'm excited to hear from Dr. Harris. And Dr. Brian Evans, the CEO of Sierra Nevada Medical Hospital. He's got 5 years in hospital administration and many, many more as an emergency department physician. Don't you get the feeling that every doctor this year is sort of an emergency department physician? Those skills have never been more tested. Dr. Evans partnered with Nevada County to establish the Crisis Stabilization Unit for Behavioral Health and created a substance use coalition with community partners. He is currently coordinating with County Health on the COVID vaccination center at Whispering Pines. And I drove past Whispering Pines this morning. There are dozens and dozens of cars down there because there's a vaccination clinic going on this morning. Pretty exciting, we're right on the edge. So I am going to stop sharing my screen and turn you over to Bernadette and Penny to get going here. There we go.
Okay, good morning, everyone. Good to see all your faces. Our first speaker this morning is Linda Jack, who is the director of the Nevada County Historical Society. One of her ongoing projects is Civility to All, Servitude to None, African American Pioneers of Nevada County. In 2018, she organized a major project entitled Over Here, Nevada County's Experience in World War I. Today, because our focus this morning is celebrating women in medicine in Nevada County, she will speak about the Sisters of Mercy, a Catholic order in Grass Valley whose members educated the community's children and cared for the region's orphans. They also provided health care to children and other underserved residents of Nevada County for over 150 years, beginning in 1863 and including the 1918 Spanish flu pandemic. So it's my pleasure to introduce you to Linda Jack.
Good morning, and thank you for inviting me, and thank you all for coming on this sort of gloomy morning, at least here in downtown Grass Valley. I'm going to do, this will be my first screen share opportunity in Zoom, so I'm going to go ahead and switch over to my slides, and I'll do a little test here to make sure you can all see what I'm looking at.
Looks good, Linda.
Okay, great, thank you. Okay, the image you see on this slide is an illustration of from Thompson and West, published in 1880. And you are looking at the Convent of the Sisters of Mercy, which sits today on South Church Street at the intersection of Chapel and South Church. Absent the bell tower on the top, it looks more or less the same as it did then, surrounded by its brick wall, which has a distinctive green gate nowadays. The church on the left was St. Patrick's Church then. It now has moved over onto Chapel Street, but in 1880 it was sitting on what is now the parking lot of St. Mary's Academy. So who were the Sisters of Mercy and how did they get to Grass Valley? Whoops, I'm not moving forward here. There we go. The Sisters of Mercy originated in Dublin in 1820. It was founded by a laywoman by the name of Catherine Macaulay, whose image you see here on the left. She used a small inheritance, and her interest was caring for homeless women and orphans. Other lay women joined her, and gradually they accumulated more customers, as it were, and decided they could become more effective if they became an institute of the Catholic Church. That they did in 1831. But they were not a sort of traditional cloistered group of sisters. They were out in the community. And because they didn't come out of one of the older cloistered orders, they had a fair degree of freedom that a lot of religious women's orders did not have. And basically their mission was what is now called prayerful service, as opposed to contemplative prayer. So they began expanding out of Ireland into all across the world, really, and arrived in San Francisco in 1854. This was a small group, all Irish nuns. The oldest was their mother, Mary Baptist Russell, whose image you see here later. At the time they arrived in San Francisco, she was just 25. And I've often tried to imagine these very young sisters traveling across the Atlantic, down the coast, east coast of the United States, across the Isthmus of Panama, which was a dangerous, hazardous business, and all the way up the coast of California. And they arrived in San Francisco to find a raging cholera epidemic awaited them. So they rolled up their sleeves of their habits and served the community for several years. And shortly thereafter established St. Mary's Hospital, which still serves San Francisco today. In the meantime, back in Grass Valley, Father Dalton had the responsibility for the entire diocese of Grass Valley, which at that time included all of Nevada County, parts of Placer and Plumas County, and Sierra County. It was a huge geographic area to cover. And he soon realized that one of the most important things he had to deal with were an increasing number of orphans. Mining was a very hazardous business, and it was a wild and woolly part of the world at the time. So he invited Mother Mary Baptist Russell to come up to Grass Valley to see if she would agree to bring some of her sisters up here. She did, and 5 sisters arrived in Grass Valley on August 20th, 1863. The first thing that greeted them was a family of 4 orphans from Sierra City, and shortly thereafter, another family of orphans, blind, lame, and poverty-stricken was the description. And within 3 months, they had 30 orphans. At the end of 1864, they had 99 orphans to care for. So the mission of the sisters in Grass Valley was threefold. They were going to house and care for orphans and half orphans being a child of someone who could not care for them, either a mother or father. The education of local children, mostly Catholic children, but also other religious denominations. And eventually they would be taking in boarders. The image you see on the right are some of the girl students, and they're sitting on the main stairs to the convent, which still exists today. And then finally, their third responsibility was the care of the sick and the poor. And just to give you a little sense of the scope of their enterprise, which it really was, in addition to the main convent on Chapel Street, they had thought appropriate to separate the boys and girls. So the boys' convent was over on Brighton Street. And if you go down Brighton, you'll see a little street to the right, or well, depending on if you come past the firehouse, that's Patrick Street or Patrick Drive. It's now a cul-de-sac, and that was the entrance to this convent, or rather orphanage. And the girls' orphanage was on Pleasant Street in Grass Valley. One of the things that the sisters did, in addition to caring for the day-to-day health of the orphans and their students, was to care for the sick in the community. And I wanted to stop a moment to talk a little bit about healthcare at this time. There was no social safety net, no medical safety net of any kind in the community. There were definitely professional doctors in Grass Valley in the 1860s, but medicine was primitive. And so the sisters really did the day-to-day care of all the children themselves. And then they also took it on to visit the sick in the community. And these house calls ran from at least 1864 to 1897. 1897 is the last ledger that we have. They may have actually continued house calls after that, and the ledger's gone missing. But they documented their house calls in some rather marvelous ways. They recorded the date of the visit, the person's name, their religion, nationality, how they were referred, mostly through the priests, but not always, their residence, the disease, and the outcome, whether they recovered or died. Most of the sisters did their calls in downtown Grass Valley, and in this particular ledger, which is from January 1871, they visited people on Mill Street, on the Kidder Track, which is over by Bennett Street. But they also made calls outside the area. In this particular day, they made a trip to Rough and Ready, which was no small feat in them. And also they were frequently in Nevada City and other parts of the county. The dangers of mining and manual labor are reflected in these ledgers. Frequently they have hurt in that column or sometimes injury. But there was also very common diseases at the time: tuberculosis, pneumonia, and strokes. This page, on this particular page, the leading conditions are cancer, injuries, pneumonia, and rheumatism. Regrettably, the sisters didn't leave us a record of what kind of care they gave, but it's logical. I think it's reasonable that they changed bandages, administered medications, and home remedies, no doubt. Brought nourishing food and drink, gave palliative care, and of course, part of their mission was to pray for the people that were ill. Interesting to me was the sisters seemed to recognize that the sort of social condition of the person they visited was almost equivalent to their disease. So on this particular page, the red arrow, for that person, the disease column has grief as their disease. And you also see frequently poverty and old age as listed as the disease that person was experiencing. Not surprisingly, the registers reflect that the sisters embrace the ethnic and racial biases of their time. White people that they visited were typically often given the honorific of Mr., Miss, or Mrs. Non-white people were generally referred to by their first name. Occasionally, someone such as Jordan Owsley, who was a quite well-known horse trainer, African-American, former slave, that they visited, he had the honorific Mr., but his nationality was listed as colored, even though he was born in Kentucky. And sometimes Mexican people that they visited simply listed their first name. This was the case with a woman named Amelia, who lived on Mill Street. And I think it's clear that the sisters used these visits to do a little bit of religious work as well. And occasionally they had a conversion. Such was the case was a Chinese man by the name of Luck, who was in the Nevada County Jail, and they visited several times. His religion was listed as heathen, and his disease was listed as death sentence. But on their third visit, they listed him not as Luck, but rather Charlie Luck, and his religion as RC for Roman Catholic. So he had converted shortly before, sadly, he was hanged on April 8th. As I said, it's unclear whether the sisters continued to make these sick calls into the 20th century. But by then, professional medical service had certainly advanced in Grass Valley. The W.C. Jones Memorial Hospital was just down the street. And that said, it's likely that the day-to-day medical care of at least the Catholic parishioners and certainly the children and orphans were handled by the sisters, with the doctors Jones available as needed. In 1913, the sisters celebrated their Golden Jubilee, but that was followed 5 years later as the so-called Spanish influenza swept through Grass Valley. This is the public health notice that was in the Union on October 22nd, and it outlines what kinds of restrictions are going to be taken. The cigar stands, ice cream parlors, billiard halls were required to close every day at 5:30, but the churches had to close entirely. So you can see perhaps parallel to our modern times where there doesn't seem to be an entire consistency about what was closed and what was empty. By October 22nd, the number of influenza cases in Grass Valley had increased to 91, and 2 people had died. Reverend Kiley of St. Patrick's Church offered the use of the priest's retreat house on Pleasant Street for a Red Cross emergency hospital. And within 24 hours of that offer, the hospital was up and running. The sisters donated use of linens and bedding, and 2 sisters were assigned to nurse the first patients, who were children. And the supplies were made available from the Jones Memorial Hospital. The influenza epidemic continued to rage in October and November, but our citizens did take a break on November 11th, 1918, to celebrate the armistice, which brought an end to the fighting on the Western Front. And you can see this is a group of people that lived probably around Brighton Street, French Street, or possibly Mill Street, based on the names of the participants. And a few of them, 1, 2, 3, 4, 5, are wearing masks, but the majority are not, even though the epidemic was at its height then. In December, the influenza surged again and spread through the orphanages and the school. Within 3 days, 69 of the 71 boys at St. Patrick's Orphanage were stricken, 30 girls at St. Vincent's Orphanage, and 4 girls at St. Mary's School. So as Grass Valley went under quarantine, the Red Cross sent 8 nurses and attendants to assist the sisters, who are now caring for over 100 children with influenza at the same time. Throughout the crisis, Grass Valley's residents, businesses, and fraternal organizations were incredibly supportive of the children. They sent funds, provisions, Christmas gifts. People in Marysville and Smartsville sent milk, eggs, lemons, and oranges. And miraculously, even though the epidemic continued to affect the school and the orphans well into January, the children improved steadily. And I have found no deaths reported in the local papers. 2 of the Red Cross nurses were then relieved to take up other assignments. But not surprisingly, the influenza epidemic also produced more orphans. So in January of 1919, the sisters admitted 7 new orphans into their care. In the last half of the 20th century, forces out of the sisters' control would change their role in the Grass Valley. In 1932, the Diocese of Sacramento opened a central orphanage in Sacramento. And as described by Father Dwyer, Grass Valley witnessed busloads of children and weeping nuns headed for Sacramento and a new era of care for the orphans. Following the relocation of the orphans, the sisters focused their efforts on education, veering away from their, to what they had done in their medical care of their charges. But by the beginning of the 1960s, women entering religious orders in the United States began to drop dramatically. They did celebrate their centennial, 100 years in Grass Valley in 1963, with a festive gathering at Mount St. Mary's, but on March 18, 2001, the last 2 Sisters of Mercy departed from Grass Valley for good. I think what was so striking to me about researching the sisters was that when the history of women in the American West is written, religious women are rarely featured. For the mythic woman of the West is defined by her role in the traditional families, such as the Pioneer Monument at Donner, where the woman with babe in arms is striding with her husband, one child, at her skirt tails. Nevertheless, these women, sisters and the nuns that populated the entire West, had the same hardships, the same adventures as their women pioneers, but because they remained unmarried, agreed to forego motherhood and live communally in poverty, they were often rendered invisible, and I think that's been the case here. Nevertheless, their contributions, I don't think could be overstated. Numbering more than 30 or so women at any given time, they served thousands of people across their century and a half in Grass Valley. They were also working in a largely Protestant community in a state that had a strong anti-Catholic bias, and yet they seemed to have wonderful partnerships throughout the community with the press, with business people, with philanthropists. So somehow they navigated those complexities and never lost sight of their mission to serve the vulnerable, poor, sick, and uneducated. In 2021, the legacy of the Sisters of Mercy lives on in our community. In 2012, the Sisters Healthcare Program, Catholic Healthcare West, changed its governance and left the Catholic Church. The newly structured organization was named Dignity Health, which operates our own Nevada County Memorial Hospital. And the Sisters Convent, with its high brick wall and distinctive green gate, is still one of Grass Valley's most historic properties. And that's now in the care of the Mount St. Mary's Historic Preservation Committee. And once our pandemic restrictions are limited, I hope that any of you who have not yet visited the museum on the 2nd floor at St. Mary's will take a chance to do so. Many of the sisters' artifacts, photos, memorabilia are there. Also, I believe an operating room from the Jones Memorial Hospital, original one, or some of the equipment from the hospital is there as well, which I think sort of reinforced the strong partnership that the sisters and the Jones, Doctors Jones had together. So with that, I'll leave you and the sisters for the moment, and thank you for your time. And I guess we'll be taking questions at the end of the other talks. Thank you.
Thank you very much, Linda. That was a great, great look into the past. We have such great history in this country. So it really is very, very amazing. Thank you very much. We appreciate your time and effort.
My pleasure.
And we'll go on
with the rest of our program, we're looking now at talking to and hearing from Dr. Dawn Harris. And there she is. Yeah, great. Thanks, Dawn. I wanted to say that the emergency room at Sierra Nevada Memorial Hospital has become the critical entry point during this pandemic. And we're most fortunate to have the multi-talented Dr. Dawn Harris as not only the lead physician there, but also the hospital chief of medicine. Both challenges at any time are really critical roles, but today even more so. It's a great pleasure to introduce Dr. Dawn Harris, who truly exhibits the spirit of women in medicine. Thank you, Dawn.
Thank you so much. What a nice introduction. I hope you can all see and hear me. And I'm used to, I'm not a lecturer. I don't have a lot of slides and pictures for you all, but what I have is my story and my experience and what brought me here as a woman in medicine. And I realize now that it's quite an honor to be here, and I really appreciate, and I can't wait to actually interact a little bit at the end and answer a few questions about what it's like to be me, a woman in medicine who has lived on both coasts and Chicago. So I've had experience all over the place. So just a couple of things that I wanted to just a couple of boring kind of stats I wanted to share in the beginning about what it's like to be a doctor today. Right now, it's still very male dominated. 64% of the doctors out there are still men. But the interesting twist on that is that most of them are over 60. And so 60% of the doctors coming up under the age of 35 are women. So more and more, the future of medicine is women. And right now, 50.5% of the residents, the students in medical school are women. So we're just kind of slowly getting over that hump. But there is a disparity amongst different specialties, as you can imagine, and especially mine. Emergency medicine, only 28% of the doctors are women. And that's reflective here at Sierra Nevada, actually. We have 12 doctors and 3 of us are women, though we just hired another one. So we're, again, inching up in that regard. So who am I and what is it like to be a doctor in medicine today? What is it like to be a doctor on the front lines? I just wanted to give you a little bit of my background and how that shaped me and molded me and made me who I am today. So I'm from upstate New York, and so I've always been a mountain girl and a winter girl, and I did my undergrad at Cornell University. And Cornell University is a very diverse place. It's very supportive of women. I didn't ever feel second best because of my gender. If I was second best there, it was because I was second best. And but it was there that I had my first experience with the competitive and frankly cutthroat environment of pre-med and medical training that can be. I can see now the sun is coming in through the window behind me. I'm an angel. So there, I fell in love with a man there, came out to California, and it was in California that I realized that you can have winter without freezing off an appendage. And so I fell in love with being out here. We got married and I went to med school in Chicago. And I want to talk about Chicago because my time there was really formative in my experience, specifically as a woman in medicine. Chicago is an incredibly diverse and wonderful and crazy place. It's an amazing place to train. Specifically, I did a lot of training at Cook County Hospital in downtown Chicago, which was made famous by the TV show ER, if you remember that show. But Cook County Hospital is a city in and of itself, really. It's a police precinct in and of itself, if you can believe that. And it is there where I fell in love with emergency medicine. in that crazy hospital, you could see from any moment someone who couldn't breathe. You would have an OB case, you would have a polytrauma multi-car wreck come in. Someone has just a laceration on their arm, then a baby comes in, then a child comes in. It was insane. So for a budding medical student, if you were interested in getting involved in absorbing and learning, it was an incredible place. But I want to talk about a really formative experience I had. So I wanted to be an orthopedic surgeon. That was what I thought I wanted to be. And so I did a lot of surgical rotations. I was finishing up a general surgery rotation in another hospital, and the chief of medicine, who I have never met in my life, calls me into his office for my evaluation at the end. And he looks at me with a straight face and he says, "Dawn, I'm going to give you an A because you earned it. But I want to tell you, I have never met a good woman surgeon." And I took a deep breath and I walked out of the room and my life changed. And I bring up, and I don't want to bring that up as a negative thing. I don't want to paint a negative picture here. I bring up that experience because it is not the negativity of the experiences that we go through in life. It is what we do with those negative experiences and how that shapes us and makes us a better person and a better doctor in life. So what I did with that experience is I took it home to my husband. Up to that point, I had been go, 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 career, single-minded. I'm going to be an orthopedic surgeon. I brought it home to him and he said, are you sure that you want to be around an environment that may be toxic to you for the rest of your life? And so what I did was I took a step back and looked at that. And what that did is it opened up everything. It opened up my mind to emergency medicine. It opened up my mind to all the things that you can experience in medical school. And it made me this well-rounded doctor who just loves emergency medicine. And I found my home. I found my place. So from that negative experience as a woman, because specifically that was aimed at me as a woman, it brought me home. So then that brings me to UC Davis. It brings me back to California. And how did I get there? And what is it like to be there? So I wanted to go into emergency medicine. And one thing that you need to know about Northern California emergency medicine training is there are only 3 programs up here: UC Davis, Stanford, and Oakland. And they're all top notch in the country. So in order to go to one of those programs, you've got to be the top of your class. Somehow I managed to pull that off and I managed to come back to UC Davis. I'll tell you something, ladies. California and UC Davis in particular is very, very welcoming and nurturing and supportive of women in medicine. It really is. California is a great place to function as a woman in medicine. It was there that I met Dr. Brian Evans, who's going to speak next. He actually trained alongside me. He was a year ahead of me, and we suffered together in those late hours of learning, where you are learning your trade and gaining confidence as a doctor, because that's really what you do during those times. So I suffered from my own lack of confidence. You have to grow as a person. You have to grow as a doctor in life. And I suffered from that, but it was at UC Davis where I found mentors and guides and really, really kind of blossomed, I would say. So then that brings me to Grass Valley. It brings me to Nevada County. It brings me to Sierra Nevada, my home for the last 17 years. And how did I get here? And it's another kind of interesting thing about being a woman. I was a new ER doctor working in Sacramento and Roseville. And one day I get a call from one of my friends who was working up here, not Brian, but another one who I knew from UC Davis. And they said, Dawn, we're thinking about hiring a woman in our ER. And again, that's just kind of an interesting and funny thing to experience. and I came up here and I would get interactions with patients and they said, we heard a woman was coming. And it's kind of fun. It was interesting. Here you are, you come from a hospital in Sacramento where kind of 50% of the doctors are women. And I came up to this hospital, which was very accepting and very, really a great place to start. But I was almost a little bit of a novelty. And that was only 17 years ago. So just, interesting backgrounds in all of this. So Sierra Nevada, Nevada County, you guys know, we have a really, really unique community. We have arts. We have so many different kinds of people here, different age groups. We have a lot to offer in this community, and it's something that we need to nurture. And our little hospital sees all the different aspects of that community all the time. And it's been a really, really interesting and incredible place to work as a woman. One thing you need to know is that we are very unique because we are small and rural. You aren't working alongside a trauma team, a neurosurgeon, a vascular surgeon. You don't have all of those different specialties. You don't have the specialist of the big toe, that you have in all of the big university hospitals in all the cities. So when you're working in a hospital like this, you really become very strong at many different things. You have to be able to handle everything that comes in the door. And that's what I wanted to kind of talk about, what it's like, what is it like for me? What is it like every day when I show up for work? Because yes, I am the ED director, I am the chief of medicine, but I'm still an ER doc and I'm still on those front lines. And in fact, I'm going to be working tonight at 8 p.m. If anybody has a problem, I'll be there. So I'm still clinical. And working in the emergency department is, and I will tell you, it is stimulating, it is interesting, it is challenging. You never know what's going to come through that door. So if you want to know what it's like to be me, 1 minute you could be sitting there and having a really nice conversation while you're working on, maybe say someone has a laceration on their hand and you're sewing it up and you're talking with them. And then someone comes through the door under CPR and you have to regroup and walk out that door and do what you do and take care of that really sick person. And then you have to talk to that family, no matter what happened, whatever the outcome of that CPR situation was. And then you have to come back and be present. You have to come back and be present for that person with that laceration. You have to be present for that woman over there who has abdominal pain and is vomiting and in distress. You have to be present for that child with that first broken bone and their really scared parent. And you have to put aside each event that's happening there, and you have to be there with that person, each one of those patients, in their fear, in their suffering, and in their healing. And that is why being on the front lines is a really cool job to have, because it's a really special interaction that you have with people. So that kind of brings me to the present time and COVID. And I know we're all sick of COVID, and I know that we're all so isolated and sick of talking about it, but it's really important. And the last thing I wanted to cover is this past year, and what has it been like as a frontline doctor, and what has it been like for all of us as people, as women, as mothers, as sisters, and Brian as a father, not to exclude you, this really, really difficult and challenging year. COVID has been, this past year has been, downright scary at times. And as a frontline worker in the very beginning, it was extremely scary. We were worried that we could come to work and get sick and die from sharing the air with our patients. And luckily, we've come a long way. I will say we've learned so much about this disease. We have progressed. I am confident now. We know how to protect ourselves. We know how to protect our patients. People were afraid to come to the hospital. Now we know that it's okay, and we can take care of you and we can keep you safe. I think one indication of that is every single ER doctor who has been working through this entire pandemic and all of its complexities and questions has not developed COVID. So we do know how to protect ourselves. And now I'm vaccinated. And I was really, really impressed to hear about how many of you are vaccinated. I applaud you, ladies. This is what is going to get us to the other side of this. And if you can't get vaccinated, you're going to be surrounded by a lot of people who are. So yeah, hopefully we'll all be safe. So I want to say one thing. Yes, the COVID epidemic affects me and affects me every day. I still see it, unfortunately, every day. So it has been difficult, and I want to acknowledge that it has been difficult for all of you. It has been difficult for all of your families. So when you have your low moments, because we do have low moments, we do. I want to encourage all of you to support each other. I want to encourage all of you to be the shoulders that my colleagues have been for me, for those people that are having those low moments. And when you are strong, be supportive for those people, because we have to acknowledge the fact that this has been hard on all of us. We have to acknowledge that. But we also have to celebrate that light at the end of the tunnel that we're finally able to see now. So, I didn't know what you all wanted to hear about, and I'm so used to kind of more of an interactive experience. So I'm really, really, really looking forward to the questions that you all have for me, and and how I can add to that. But that's it. And I'm hoping that we have some time for questions later on, because I'm looking forward to that too. And again, thank you so much for having me. I am definitely out there as a woman in medicine, and I intend to be out there for a long time and continuing on in the front lines and also as a leader in our hospital. So thank you so much for having me. I really appreciate it.
Oh, thank you. Thank you, Dawn, so much. You really are an angel, one of our heroes among many up in the hospital, at the county, here in our area. And thank you so much for sharing all your personal feelings about activities that you've been doing. Fabulous. Thank you. So at this point, I would like to thank Dr. Evans as well. Dr. Evans recommended Dr. Harris for our speaker, and he certainly hit the nail on the head. She did a beautiful job. Thank you, Dawn. The next speaker is Dr. Brian Evans, who is here. I would like to say that in my husband's view, it's really important to have the right person at the right time in the right place. And I think that was something that was accomplished with Dr. Evans coming about 2 years ago from Mercy Hospital, where he was the chief of medicine, and before that for many years in the emergency room, as you heard Dr. Harris say. Dr. Evans has been in the emergency room for many years. He's now the CEO, and he's been leading us through very, very difficult times this last year, as you all know. It's my pleasure to introduce Dr. Evans, and let's hear what he has to say. Thank you.
Thanks, Bernadette. And you can see why I asked Dr. Harris to join us today. That was an extraordinary story. And thank you. She's done an enormously good job of running the emergency department, taking incredible care of patients, both COVID patients and every other patient that we have coming here to Sierra Nevada. And the level of commitment that she's shown to our community, I think, is evident. So thank you, Dawn. Okay. Well, I have a number of different things that I'd love to talk to you guys about. I don't know how much time I've got, so I'm gonna try to be relatively efficient. We could spend probably the next 6 hours talking about the impact of COVID on our community and in our hospital and everything else, but you probably all have other things to do today. So we'll talk a little bit about that. I do want to just show you a picture real quick, so I'm going to share my screen if this works. Hopefully it does. Let's see here. Can you guys see this picture?
Yes.
Good, okay. So this, since I'm speaking to the Association of University Women, I wanted to show this picture. The woman that is labeled G. Lenore Campbell, that's my great-grandmother. This is the graduating class, actually, of the College of Medical Evangelists, which is now known as Loma Linda Medical School. This is one of the earlier graduating classes. I believe it's 1917. You'll notice there's 7 men in the graduating class and 4 women. The Seventh-day Adventists were pretty big on the advancement of women in science and in education. Dr. Campbell was quite an extraordinary person. She not only graduated there, but she taught pathology at Loma Linda, and then she settled into a general practice in San Jose for many years, and it truly was a general practice back then. She was kind of a one-stop shop for almost everything. She did a lot of OBGYN, she did quite a bit of surgery, she did internal medicine, she made house calls. She was an extraordinary person. She was known to have, to be somewhat of a force of nature. Dr. Harris has quite a congenial approach to interacting with people. Dr. Campbell, not that kind of reputation so much. She was known to walk through the halls of the hospital, and if somebody was smoking, which they did inside back in those days, she would grab the cigarette out of their mouth and throw it on the ground and stomp on it. So she was that kind of a person, and she was really an inspiration to many. Some people actually asked me if she was the reason why I went into medicine myself, but it wasn't. It was actually Hawkeye Pierce from the TV show MASH. I was really into MASH when I was young, and I decided I wanted to be Hawkeye Pierce. I wanted to be a surgeon too, just like Dr. Harris. Because of Hawkeye, I wanted to be a general surgeon. But then I went to med school and realized that most surgeons were not that fun to be around, to be honest. So I had kind of a similar experience to you, Dawn, and realized that I needed to find people that were a little bit more fun and enjoyable to spend my career with. And that did turn out to be the emergency room for me. ER doctors tend to be good storytellers and enjoy things other than just putting knives into people. So that's a good thing. You know, this has been an extraordinary year plus now with this COVID pandemic, and being relatively new to a hospital president role and then dealing with a pandemic has really been kind of a trial by fire. What has been extraordinary is the level of collaboration here at the hospital and outside the hospital with so many different people, so many community members and partners, the county itself, physicians all over the place, people volunteering. And that for me has been the silver lining of COVID-19. It has been difficult. There's no doubt about it. There has been tremendous fear and anxiety. People have worked really, really hard. And I think we're going to be in kind of a mental health recovery phase for quite some time as this pandemic hopefully winds down over the months to come. But I'm just really proud to be part of this community and this hospital with so many people doing incredible jobs, taking care of patients. You know, Dawn mentioned, you know, what it's like to be at the beginning of a pandemic when not a lot is known about this infection, and taking care of patients, wondering if it might cause your own death. A lot of people have been dealing with that fear and showing up anyway, showing up for work and taking care of patients. And those people are heroes. They truly are heroes. I will kind of point out that when we started out with this pandemic, there were a lot of projections about what was going to happen to community hospitals like ours. And there were a lot of statisticians and mathematics people who were predicting alarming surges in patients. admitted patients, ICU patients, people needing things like ventilators. And all of us across the country and really across the world started doing things like counting up how many ventilators we had, how many ICU rooms we had, how many nurses we had at a maximum capacity situation, and then comparing that to what the projections were showing. And if any of you were looking at those projections like I was pretty obsessively a year ago, it was very scary because the numbers didn't match up. The projections showed that most hospitals would be totally overwhelmed by huge numbers of patients coming in, and Sierra Nevada, wasn't really looking like we'd be able to keep up with the volume of sick people. And so then we all started hearing messaging about, well, we need to flatten the curve. We need to, all of us stay home. We need to put on masks. We need to wash our hands and many other things. And if we can do that, we can flatten the curve. And then we started to see new projections arising and we started to feel a little bit more optimistic, but we were still quite anxious about it. Now that we've got the perspective of time and we've been able to look back at what actually happened, we have seen some pretty significant surges in patients, but nothing like what we were afraid of happening. We here at Sierra Nevada have seen a peak number of admitted patients of 15. So 15 patients at any one time with COVID-19. So this hospital typically runs a census in the high 40s. We max out, somewhere in the mid 70s or 80. 80 would be a really high number for us to have admitted at one time. And, so we've gotten through it. We've gotten through some of these huge peaks. Now, that's not to say we're totally through this pandemic, but I can tell you a lot of the fear and apprehension about being overwhelmed is gone. I mean, we have a new tent and we had all kinds of surge plans and we talked about how we were going to turn conference rooms into ICUs and all these kinds of things. And the biggest concern we had, frankly, was not square footage in the hospital or the number of ventilators that we have and other equipment. It was people like physicians and people like nurses especially. That's where the rubber would really hit the road. We did not have nearly enough nurses to take care of the huge numbers of patients that we predicted might come. Fortunately, we sort of squeaked on through and we're doing well now. Some of the other hospitals in the region struggled more. Places like San Joaquin General and St. Joe's in Stockton, those hospitals really got hit pretty hard with COVID patients. I know St. Joe's had to set up an ICU in their emergency department. They had well over 100 COVID patients at any given time during the big surges. And our partners in Sacramento at Mercy San Juan and other hospitals really had quite a few patients. And of course, as you all know, many people have died as a result of this infection. So at this point, I think there's been many lessons learned about how to deal with the pandemic. And one of them is making sure that we collaborate very, very closely with our partner health systems and partners within the county and other healthcare providers. We're continuing to do quite a bit of that. And now we've sort of shifted into vaccination mode. So we're still doing all the things about getting supplies and equipment straightened out, and we're doing very well with all that stuff now. But the vaccination rollout is really where a lot of focus is being put at this point in time, because that's the way forward for our community. As Dr. Harris said, that's how we move out of this. We get the community vaccinated, we get to a point where we have herd immunity, and then we can start to re-enter normal life. I would say that the distribution of vaccines in the United States has been clunky, to say the least. It has been really a logistical challenge, and people wonder why that is. And there's many reasons why. Certainly, the administrative approach to it at the federal government level was probably not ideal on the front end. And then the other thing that happens is in the United States, we have 50 states that all act somewhat independently, like 50 different countries might do. So they get all these vaccines and then they have to figure out what to do. And so California is doing it different than every other state in the entire country. And it's unnecessarily complicated that way. And then each county within the state has its own processes and the rules for who to distribute to and how you can do that and all these things, all the tiers has been changing constantly, making it really difficult to navigate that. The hospital has done its level best to try to get vaccines into arms, and we've actually done really well with that, not only in doing our own vaccination clinics, but also working with the county very closely to do things like Whispering Pines, where we have our medical office building up on Whispering Pines that we have essentially given over to the county and help them set that up. And we continue to do mass vaccination clinics here as well. So it's been a learning process. And at this point, what's happening, this is the latest curveball, we now have a third-party administrator in California that is essentially dictating who gets vaccines and how many they get and when. And that third-party administrator is Blue Shield. So Blue Shield was given that contract, and now the hospital is not actually getting any vaccine doses because they're not giving it to the hospitals directly. So we are now getting vaccines from the County of Nevada, and that process has its own challenges. So many different curveballs have been thrown our way, but we're just trying to deal with each of them. One of the things that has been really fascinating and frankly somewhat disturbing, and I don't know if folks will have questions or comments about this here, but the science of this pandemic, the science of how COVID-19 behaves, and complex questions about vaccinations and viruses and epidemiology, and simple questions like, do masks work? Or should you go indoors and breathe on one another? These kinds of questions that have been extremely important for us to have a unified understanding of as a population have become incredibly political, and science is really under fire and has been marginalized as a result of COVID-19. Of course, that didn't start with COVID-19, it started well before that, but I've been quite alarmed by the fact that the general population of the United States does not seem to have a good understanding of the way science works, and also how to find information that is accurate and non-biased. So that lack of understanding of where to source information has been pretty challenging, I would say. And not just sort of, out in the community, but even within our four walls here at Sierra Nevada. One of the things that I started to do when the vaccines were becoming available is I would round all over the hospital and just ask if people had any questions about vaccines, and just do sort of a Q&A with our own employees and whoever I might run into, which was a lot of fun. Many people were very clear that they understood the science, and they're science-based folks like you guys are, and other people not so much. And I remember talking to a number of them and trying to understand why they had such firmly held beliefs in really delusional myths that are not true. One person thought there were microchips in the vaccine and Bill Gates was going to try to control her. Other people just had completely wrong understanding of the safety and the effectiveness of these vaccines. And it was challenging for me because I wasn't going to try to convince anybody that they should get a vaccine. They're not mandatory. But I do want people to understand the questions and understand the science of them. And I think we've slipped as a country in terms of our ability to understand complex scientific issues and have scientific literacy. So that's been a bit of a mission for me when I talk to people and groups about how do you actually source your information. And what I've concluded is that so many people are getting their information differently than they used to get it in the past. And for those people who went to college or medical school or got scientific training, they're very used to vetting information sources, understanding why somebody might be a reliable source of information, or a particular newspaper might be a reliable source, or a journal like the New England Journal of Medicine, and then understanding how to find out whether there's bias or not, conflicting pressures. But most people now are getting their information from social media, and social media is quite different than that. And it really is not vetted in any way, and it tends to be individually curated for people. So people will get a stream of information coming, and depending upon their own personal biases, they will end up kind of going down a rabbit hole of additional information that can make them more biased in the end, to a point where you've got an inability to really talk sense into folks. So really a challenging time for our country and the world to manage that. And I think it is the challenge of our generation to figure out how to get folks to remain educated and vet their sources of information. So that's been on my mind quite a bit. At this point, I would like to turn it over to questions, and you guys can ask me anything about the hospital. I do want to say this because I saw Stephanie Fashini was on the call, and I'm very proud of my two daughters, who Stephanie was their 6th grade teacher, I believe, many years ago. They're now 22 years old and just graduated from college last year, in large part due to the fantastic education that they got in the Nevada City School District. Maddie is actually pre-med, so she's studying for the MCAT right now. She'll be taking that test on the 26th, so 6 days from now, and hopefully getting into a good medical school starting in the fall of 2022. Laurel graduated from Berkeley with a degree in math and molecular and cell biology, so she's a smart cookie as well, and very proud of those girls. So I think they are continuing the tradition of my great-grandmother Lenore Campbell, who I think blazed a trail for all of us. And with that, I'll turn it back to you, Bernadette, and I'm going to look at the chat and see if there's questions that I should be answering.
Okay, we also, thank you. You really have given us an education on COVID and your feelings of what's going on in the community. I'm glad that a lot of us are getting vaccinated and help the cause along the way. Susan Rogers is one of our members, and Susan will be in charge of kind of going down through the chat box, and she'll read out questions to all 3 of you as we go along. And again, thank you. We appreciate your taking the time and the effort and the information you've given. Loved having Dawn Harris with us. She was delightful telling us her stories. So Susan, go for it.
Thank you, Bernadette. And I'll just take the questions in the order they came, which was sort of in the order of the speakers. Bup is asking, did the Sisters of Mercy have any particular training? This is for Linda, of course. Did the sisters have any particular training in nursing, or did they simply do what kindness dictated? Linda, are you here? Or maybe you need to unmute yourself there, Linda. Let's see here. Yes, there.
Okay.
Thank you.
I haven't seen any evidence that they were professionally trained in any way. These young women entered their order at a very young age, so in their late teens, early 20s at the most. So they hadn't probably had a lot of education anyway. But I think they basically just jumped into it, and there wasn't all that much you could do for certain kinds of conditions. So if you were in a cholera epidemic, you did the 3 or 4 things that would make it easier on the patient. But I'm sure they lost a fair number of patients anyway.
Okay. And Bob was also asking, how did the sisters pay for all the things that they did? Because they had so many children to feed and clothe and educate.
Oh, they worked. I think it was a full-time job. They had fundraisers. They made begging campaigns where they literally went all through the region and into Nevada begging for funds. My take is that the male orders in the Catholic Church were much more supported than the female orders. So although they got some funds from the diocese, they were pretty much on their own. And but I have to say the community here was so supportive, Catholic, non-Catholic. And I think the community saw the orphanage in particular as a community asset and as a really important measure of the community's worth. So they had donations from everyone, and they were meticulous about thanking them. Every time they had a fundraiser, there was a big ad in the Union thanking everyone who contributed. So, but I think it was, basically living from day to day.
Well, and then I had a question. You mentioned, the slide mentioned that they took care of orphans and half orphans. And since women in that time had no legal rights to their own children, if the husband died, let's say in a mining accident here, and they weren't able to find a male guardian for their minor children, were those children then considered, let's say, either orphans or half orphans and went to the orphanage?
No, I don't think so. California was only one of 3 states in that era that recognized that there might be women alone that needed some kind of rights. And they actually had what was called a sole trader law in California, which said if a man abandoned you or died on you, that you had a legal right to have your own business and work to support your children. So my sense is that these were half orphans were just circumstances didn't allow the living parent to care for the child, and they could come in and then come back out of the orphanage as circumstances changed.
Ah, great, thank you. And some questions for Dr. Harris. Anne is asking, how do you keep balance in your life and recharge yourself?
Oh, that's a really good question. I will say that, well, living in this area is perfect for me because one of the things that I do for balance, because recharging and recovering from ER shifts and things like that is actually another part of the job. In order to recover and not get sick yourself and not get too physically overwhelmed is really important. So health and wellness has been like a huge part of my life, and exercise, believe it or not, is the thing that keeps me going. I've been a trail runner and hiker and skier all my life. I mentioned the mountains, I mentioned the winter. There's a reason why I live here. I can get on the trails right out my back door. And something about being outside and moving is incredibly healing for me. I rely on friends and family. I think that I have been one thing about medicine is you're kind of taught in the beginning to be very kind of perfect and superhuman, and you're not allowed to have feelings and you're not allowed to fall down. And so one of the things that I have taught myself to do as I have gotten older and wiser is to let those feelings out and talk to my friends and rely on them and allow myself to be vulnerable, allow myself to be weak in the moments that I can be. So exercise, eating right, and my community, which of course has been tough this last year.
I think exercise releases endorphins, don't you medical
Yes.
people? Right, right. And
Yes.
also I've heard that like lactic acid builds up in your muscles, and so exercise helps release that out. Is that accurate?
Yep. Yeah,
Okay.
that's accurate.
All right.
And also exercising with your animals. That's another thing. You get all that oxytocin from your animals too. So if you have horses or dogs, that's a good thing.
Okay. So I have a question. Did you watch ER, and do you now watch New Amsterdam? And if so, how realistic are those shows about what really happens in the ER?
Oh, that's a great question. No, I cannot stand medical shows. I don't watch ER. I don't watch New Amsterdam. It drives my husband will be like, stop yelling at the screen. We know that's not accurate. We know that's not accurate. I mean, yes, medicine can be highly dramatic, but I'll tell you what, we don't have time for all of those affairs that they're always happening on those shows.
Okay. Jennifer Sylvester is asking, Dr. Harris, what advice would you give for new women nurses?
Oh, goodness. Well, first of all, it's a great job. It's a hard job. I applaud people going into nursing. It's a calling, just like being a doctor. You have to want to do it. You have to want to do it. So my advice to them would be, put your heart into it, believe in yourself, because what each person uniquely brings to the table is what makes them a good nurse or doctor. And I think, and to stick with it and realize that you're actually doing an incredible thing for your community.
Great, thank you. From Susan Miller, you commented that none of the doctors got COVID, and she's asking, what about any of the nurses or support staff? Did any of them contract it through, as far as you can tell, work in the ER rather than some other way?
We did have some nurses contract it. my suspicion is that it wasn't from work. We don't really know. We're tracking, of course, who takes care of COVID patients and things like that. Maybe Brian can speak to that a little bit more up on the wards, because I'm not aware as much as what nursing staff, whether they feel that they got it from work. But we did have a couple, but honestly, our ER and our hospital has not been highly impacted as a staff.
Yeah,
So
we were.
they're-
Yeah.
I'm sorry.
Oh, sorry, Don. We were looking at this at a divisional level, with the 6 hospitals that we're affiliated with in Sacramento. And there were certainly quite a few people who were out. They were on quarantine with COVID infections. And, like you said, it's kind of hard to tell sometimes if they got it at work or if they got it from family or somewhere else. But I can imagine that some people probably got infected at work. It's hard to prove that didn't happen. But when you think about, all the COVID patients we've been taking care of, and it's a relatively small number of people that, got infected at work, I think it's a testament to the protection that people are taking and they've been careful. So, overall, people doing a pretty good job of that. And then the other thing I'll say is that people could get it at work from their coworkers, not just from patients. So, and that's why we screen everybody, but the screening's not perfect. So if you've got COVID and don't know it, and then you're in the break room having lunch and somebody comes in and the masks are off, it's a problem. So we've had so many different rules to try to deal with that. And it's honestly, it's impossible to keep infections at zero. It's just very, very difficult to do your best.
One thing I will say is that I've learned through this whole experience in being scared and then not scared, is that I really believe in my mask. Masks work, and it's protected me and it protects other people. So I have this firm, safety. It makes me feel safe.
Okay, thank you. So Bub is asking, this is probably for Dr. Evans, since this community has a high percentage of those over 65, how do you think we escaped from the high infection rates that those early projections suggested?
Well, people stayed home and wore masks. That's what happened. The curve flattening, that's exactly what we were hoping would happen. And the community, for the most part, not everybody, but for the most part, people were careful. They put on masks, and they stayed home. They didn't have parties. A lot of people have told me, I've done so many vaccinations now, and a lot of the people I'm vaccinating will tell me, I haven't seen my mom for, a year or whatever. And it's like, that's unbelievable. Tons of people are in that situation. So people have followed the rules. Mm-hmm. Now, the reason why, we're still having problems across the country is that not everybody's following the rules. People have opened up too quickly, and some people have been way too cavalier, including in our own community. And that's unfortunate because we're still purple, there's no reason why we should be. But
one thing I want to speak to that a little bit too. Brian touched upon the collaborative efforts among the community here and what we did in preparation. I was highly involved in all of those meetings and preparation things. And one of the things that I want to send some kudos out to when you're addressing the over 65 age group is that our nursing homes did a really good job for the most part of containing and protecting their residents. We were really, really afraid up here that, one of our nursing homes has 3 times the number of beds that we thought that we would have available for them. So if one of them went down, we were going to go down, and that did not happen. That never happened. So they did a fantastic job of keeping their residents safe and containing any outbreaks that they had too. So I just wanted to mention that.
Thank you. Lonnie is asking Dr. Evans, how are you getting sufficient PPE now? And has COVID impacted your budget seriously?
Yeah, we're good on PPE. The production of PPE had to increase significantly internationally to deal with this because people are still going through a lot of masks and gloves and things like that. But we're good on that stuff. And then on equipment, we're good too. In fact, we found out that we probably have an embarrassment of riches as it turns out with ventilators. We have more ventilators than we need. And we ended up loaning out ventilators to a number of other hospitals like Dominican Hospital in Santa Cruz, and St. Joseph's in Stockton. And we never got to a point where we were going to run low on that stuff. As far as the budget, absolutely. So we, and this is something I think everybody should know in Nevada County. This hospital is your hospital. It's we're affiliated with Common Spirit Health and Dignity, but we are owned by this community. So you guys are my boss, technically. And you have to make a margin in order for a hospital to remain solvent and then reinvest in itself and continue to upgrade and deal with equipment aging out, et cetera. And this year we are basically a break-even organization. And that's not good enough, actually, to be break-even on margin. You have to have a margin. So COVID has been problematic. I think we would have done quite a bit better this year because we were successful in recruiting surgeons and doing some other things that would make this hospital more financially solid. But no, the COVID has really been impactful. And by the way, that break-even status includes the government assistance that we have gotten, which was substantial through the CARES Act. So, so we really have a challenge ahead. The COVID pandemic is likely to cause some permanent changes in the way that hospitals deal with financials, and we're going to have to figure some things out going forward to deal with that. I will say this though, we're in a stronger financial position than most other community hospitals because of our balance sheet. We have quite a bit of cash on hand as an institution, actually over 1 year of cash on hand, which is excellent. So the CFOs on the call will know a year of cash on hand for a hospital is fantastic. The target for most hospitals is 90 days. And many are, basically struggling to just have any cash on hand and not go bankrupt. And I will say this, over the last 10 years, 120 rural community hospitals have closed in the United States because of financial problems. And my mission in life is to make sure Sierra Nevada is not one of those going forward.
We're glad to hear that. Thank
Yeah.
you.
Well, it's going to take all of us.
Okay, so Susie Monterey Wilson is asking Dr. Evans, I know our county has an annual drive-through flu clinic. Are you anticipating an annual drive-through COVID booster clinic?
It could be that happens. So people have asked, is the vaccine going to cover me for all these variants that are coming down the line? And the answer is we're not really sure what's going to happen with that. My prediction is that the variants will probably become more prominent at some point. Each of us that's been vaccinated is probably going to end up needing a new booster vaccine at some point to deal with those variants. But that's getting a little far ahead of ourselves. As far as whether it needs to be a drive-through, it could be. We could do a drive-through, but the way we're doing it now seems to work pretty efficiently, which is people get out of their car and come in. And that seems to be a little bit easier to deal with right now. But I'm not opposed to a drive-through. I mean, it is America. We'd like to drive through and get stuff like burgers and whatnot. So I'm in.
Mocha Rockets at Big A. They'll bring it to your car. Okay, so our first speaker, Linda Jack, is asking Dr. Evans. She says, I agree about the lack of science literacy. And when you couple that with civic literacy, that makes it especially worrisome during this pandemic. And worrisome to see those two things intersect this past year. And I've been involved with media literacy for the past 20 years and the whole thing about social media and what that's done to people's ability it's not so much their ability to think critically, but there are just so many more sources now than there used to be. And people don't know how to vet the sources, like you were saying.
Exactly.
Yeah.
One thing we've been talking about, I've been talking about with people is how do you actually figure out if your news sources are biased or unbiased or accurate or not? And that can actually be tricky to do because people just think whatever the news they watch is great, And one thing I try to tell people to do is there's various ways that media sources are evaluated for bias and accuracy. One of them is a site called Ad Fontes, but there's others. I don't know how many of you, raise your hand if you've ever heard of Ad Fontes. Okay, yeah, okay, good. So I try to send people in the direction of this website because it's actually a very solid scientific approach to evaluating media sources for bias. And then they plot them out on a curve. And I can bring that slide up if you guys want to take a look at it. I can do that while we're taking more questions.
How do you spell that, Dr. Evans? I'll put that in the chat. Is that Ad Font?
Yeah, I'll type it in right now.
Okay.
Let's see here. I'll just put it in. Yeah. There you go.
Is that .com? Probably.
Yeah, if you just Google that, you'll
okay.
You'll go right at it.
Okay. So while you're pulling that up here, let's see. Jennifer is asking about nursing resources. She says nursing resources were a critical concern to meet the COVID surge predictions. Can you comment on how women nurses have evolved to support critical healthcare needs?
That one for me.
Oh yes, I've seen this screen before. Yeah.
Yeah, okay. Yeah, I'll answer that question just a sec, but if you guys can see
Sure.
my screen, this is the main output of the Ad Fontes research. So what they do is every single one of these media sources, their content is evaluated by a very large number of people from all sides of the political spectrum in the world of journalism, and they assess for accuracy and bias, and then they plot it out. So on the y-axis, they're looking for accuracy. And then on the x-axis, they're looking at political bias, essentially. So what's interesting is that you find that the more politically biased a news source is, the less accurate it tends to be. So it forms this sort of an inverted V. And if you're way at the top, you're pretty accurate. And if you're right in the middle, you're pretty much unbiased. And so, if you sort of stick with news sources that are in that box at the top, you're doing pretty well. But that's not to say you can't ever read a story from one of the other sources. You can do that, but there's got to be a little bit of a, well, I know this source might be a little biased on the left or the right. What's interesting though is that people tend to gravitate farther and farther to the extremes over time through their curated, individually curated news stream that they're getting on their phone or their computer, because the computer and the phone knows what you like. It knows what you click on, and it's going to give you more of the same. And it tends to make people separate further and further from the middle. And that's a very dangerous situation to be in, because now we're going to end up with a situation where half the country can't talk to the other half. I've seen arguments in the doctor's lounge because you got one guy who's, he's watching Fox, and the other guy's watching MSNBC, and they can't even have a conversation anymore. And it's really unfortunate because, if you're an educated person, if you're a person of reason, we should always be going for, unbiased, accurate information, and it needs to be vetted. So I think this is a helpful tool. It's not the only tool, but it's certainly better than nothing, which is what most Americans are doing.
Thank you. That's very interesting.
Yeah, you bet.
This question from Jennifer may not be easy to answer. She's asking if you can comment on how female nurses have evolved to support critical healthcare needs.
Well, first of all, I'll say this. I think that COVID has revealed how critically important the resource of nursing is in this country. And it's not as elastic as we need it to be in the event of a huge surge of patients nationally. We did okay with the nursing, but we were stretched pretty thin. But there are plenty of other places where they simply did not have enough nurses. They had to go into a different nursing model where they went well out of ratio, or they went into team nursing models. Nurses have been very burned out because of having to work extra. It's very, very difficult to do that. And I don't know that we have a good solution to this problem. I do think that you can always say, well, let's train more nurses, and that's fine. But we also need to figure out a way to make sure that they remain in balance, like Dr. Harris was talking about, because they absolutely get very burned out. And back to the question that Dawn, you answered, what advice would you give to somebody who is entering the field of nursing right now? I think about that with nurses and physicians, what advice to give, especially my daughter who's going to be applying to medical school here soon. It's hard to really give them an accurate understanding of what they're in for, until you get into it, because it's just almost indescribable, the kind of situation you're going to be dealing with. What, Dawn, you were describing, the variability that comes into the emergency department, from the mundane to the extraordinarily dramatic and intense. That kind of an emotional roller coaster is pretty difficult to prepare yourself for mentally. And then doing that in the middle of the night at 3 a.m, and then not getting enough sleep, and then doing it again the next night it's a real big challenge. So I think we need to really focus on mental health needs for our healthcare providers generally, and we need to figure out ways to support them. And I don't have a great answer to that. We certainly talk about that and try to do things here at the hospital to support folks, but I don't think we've gone far enough.
So I'm going to jump in here for a minute. We've kind of run out of our time allotment. Bob, how are you feeling about, there's still quite a few questions in the chat box. How do you feel about where we are?
if our presenters are happy to stay for another few minutes to answer questions, I would love that. But of course, they've been here a long time, so we will make do with whatever you guys will work with.
Well, I will just make a quick plug. We do communication in a variety of different ways here at Sierra Nevada. One thing I've been doing that seems to be helpful is making videos every week, roughly every week. And we post those on the Sierra Nevada Facebook site. So if you've got Facebook, you can follow us, and then you can kind of get updates on what's going on at Sierra Nevada, and then ask questions, and we'll try to respond to those. I think it's very important for our hospital to communicate directly with all the people here that own us. You guys are the owners, remember? So I gotta keep you happy. We also do a number of different things with KNCO and KVMR, but predominantly KNCO, where we do interview shows. I do interview shows once a month. Kimberly Parker, who I'm sure many of you know, has her interview show as well. And we also do Healthy Tuesday. So those are the main, Healthy Tuesday in the Union newspaper. So those are the main ways you can get information about what's going on at Sierra Nevada. But certainly feel free to reach out to me or to Kimberly Parker, and Bernadette always knows how to find me for sure. She can track me down any place, and so can Ed. I think he might've been on the call earlier as well. But yeah, I really appreciate the opportunity to come here and talk with you guys, and great questions. And I'm starting to feel cautiously optimistic that we're going to get through this whole pandemic together, and maybe we can have an in-person meeting sometime. I'd love to do that.
Wonderful. Yes, that'd be great. Thank you very much.
Dr. Harris, did you want to jump in with anything to wrap up here?
No, well, so much has been said over the course of this meeting, but again, thank you all for having me. It's been a very challenging time. I think that our community has really kind of come together and risen above in this challenging time, and it will continue to be that way. So again, I'm here if anyone wants to, ask me any questions. I can maybe stay on for another 10 minutes, but again, thank you for having me. And I really think this was quite an interesting talk.
There's one nice comment from Anne in the chat to Dr. Harrison Evans. She says, "You'll be happy to know that our scholarship team is currently reviewing applications from 3 high school girls pursuing a career in medicine. And many of our re-entry women who get scholarships who are going to Sierra College are in pre-nursing and nursing programs."
Awesome. Fantastic.
Great.
Good.
Let's get them to sign up locally. We can use them all. Linda, did you have a final comment you'd like to make?
Just one. Number one, again, thank you so much for having me. This has been such an interesting experience, and I really appreciate it. I would like to make one plea as an historian. The sick call registers of the sisters, 33 years worth, are a treasure trove of medical history waiting for a researcher. So if anyone knows, and they have been digitized, so if anyone knows any retired doctors or any other kinds of medical folk that would like to do a bit of a project, it would really give us a lot of insight into what the medical conditions were in Grass Valley in our historic past. So just send them my way if anybody knows anyone. And thank you all so much.
Wonderful. Let me put in another final plea also that's related to the program. If anyone wants to thank the wonderful staff of the nursing homes, you might consider going to the hospital, buying some C's candy from the gift store and taking it to the staff of some of our nursing homes to thank them.
There you
can
go.
go nicely.
Very good. Thank you all. Thank you all very, very much. I think maybe we've extended our welcome here. What do you think, Bob?
I think we've asked enough of these wonderful people. They've been here for an hour and a half. And Dawn, do you want to, thank you so much. It's been a revealing and a really rewarding morning for AUW. You guys have been terrific. And the state of women in medicine looks pretty darn good.
I think so too. And if you are interested, hopefully we'll have this recorded and on YouTube on the AAUW YouTube channel. So check it out.
we're there. Thank you all.
Thank
Thank
you.
you.
Thank you.
Bye-bye.
Thank you.
You.